Today's video is about illness symptoms and managing your response to the illness symptoms. I'll explain this a little bit, but let's start by taking a nice deep breath, as deep as your symptoms will allow you to breathe if you're dealing with breathing issues. Nice deep breath to what you can tolerate. And as you breathe out, pay attention to the shape of you, and specifically, I'll invite you to pay attention to where your physical symptoms are. Now, as you continue to breathe, I'll explain this a little bit as you notice where the symptoms, where the feelings are, and where they taper off. You want to be seeing the proper medical professional for any sort of physical illness. This is definitely not a substitute for medicine, but when it comes to the waiting time in between, that time when you're waiting to see your doctor, that time when you're waiting for medicine to kick in, or that time when you just need to wait because there is no medicine for it, this is an important time for you to be able to raise your level of consciousness and collaboration with the body-mind system. So take a nice deep breath within what you can tolerate and bring your awareness to where the symptom is. Whether it's the type of common cold symptoms like postnasal drip, throat issues, lung issues, cough issues, nausea issues. Recognize this: when you pay a little more attention to it, sometimes the symptom rises, and so don't be afraid of that reality. If it becomes intolerable, take a break. Stop the exercise. Don't keep doing it. But as long as you can tolerate it and you're not becoming emotionally unhinged or physically way too ill to handle, just go ahead and pay attention to where the feeling is as you breathe and as you keep noticing your body's cues as to any sort of movement or shifting that you need to do. Just paying attention and breathing. Noticing the shape of you, the space that your body occupies, and finding where you're noticing that symptomatic behavior in the body. As long as you can look at it curiously instead of hating it, as long as you can look at it curiously instead of purely wanting to run from it, what ends up happening, and it happens again and again with people, is that they tend to get a reduction in the intensity of the symptoms or a narrowing of it. Either that or they clear out a little quicker than usual. Even though I'm no expert on the dynamics of healing and illness and the body, the fact is that your immune system does respond quite a bit to your being able to be calm. And you're being able to watch things that feel bad in a curious way instead of a hateful or a resistant way. It definitely is, it employs the major counterbalancing weights in your nervous system against the fight or flight system. The fight or flight system is absolutely necessary, but so are these inhibitory systems, and several of the major counterbalancing weights, including the mid-front area of the brain, definitely can be employed by your curiously watching the shape of the feeling and expanding your awareness beyond to where the feeling clears out. So keep taking each breath in and each breath out and noticing where it is. If it was a cough, that's a tricky one because you have this tickly feeling inside and it might get worse while you watch it. But if you're able to watch it curiously instead of immediately reacting to it, being able to slow down the response to it, what often happens is you'll get more of the productive coughs. So be a little ready for that. Be a little ready for the cilia action to happen and to bring up some more stuff when you finally have to cough, when you feel compelled. If you're able to breathe and notice and get curious as to what's going to happen next and what you have to do and what you can control, what often happens is your body responds with more productive and appropriate action instead of overwrought, overdone action. So nice, comfortable level of breathing. If it's a cough, yeah, you really want to be careful about how deeply you breathe. But breathe and notice the sensations and what you're able to control and what becomes utterly compelling. When it comes to nausea, that's another tricky one because a lot of times there's a real revulsion response to nausea, but bring your awareness to the shape of it and expand your awareness to the place where the nausea clears out, where there's not nausea. For example, a person might feel nausea in the middle or upper stomach area, but they might, and somewhere in their head, they might get some dizziness and some weird feelings in the head. But if you stretch your awareness beyond to the clear spaces in the body where there isn't nausea and where there isn't dizziness, a lot of times that's a stabilizing force as you continue to watch the shape of you. When it comes to itching or pain, definitely paying attention to where the pain is, regardless of whether it's entirely in the body. Pain isn't always manifesting in the body. You don't always feel it right in your body. It's the nervous system has this interesting triangulation factor I'm not an expert on, but definitely people do feel pain outside of their existing limbs and body from time to time. And so it's okay to just notice where it is and then notice where it clears out, where there's a clear space, especially a clear space in your body. If your whole body feels bad and you need to actually expand your awareness beyond the body, that's great. Just mindfully stretching your awareness into clear spaces around you can have a balancing force as you engage your proprioceptive system. You pay attention to sort of with your body's GPS where the pain is and where it isn't. Usually there's some portion of the body that doesn't feel pain, even if it's a tiny little spot just hidden somewhere in the body. Just go ahead and pay attention to where that is. Bring your awareness into that, noticing that clear space as you breathe. Bringing awareness into the shape of you. Turning off the hyperactive threat response by noticing that there isn't a real threat around you, but there is some action going on inside of you. Allowing yourself to notice the actual happenings in the body instead of your fears regarding them. A lot of times the racing thoughts start to calm down. The frantic feeling begins to settle out. Certain parts of you start to increase in their flow and their openness, and other parts of you are able to sort of stabilize themselves as you do this. Sometimes you get some heat in the body. That's not a bad thing, as long as you're not at risk of a deathly fever. As long as you're able to tolerate it, stay with that feeling of warmth or heat that comes through the body. Don't be afraid of it. There might be some shivers that come on. Those are not a bad thing. As long as you're not about to go into a seizure or something truly dangerous. Pay attention to where the shivery and the vulnerable feeling is. That's the body's maneuver to moving towards greater release and solidarity. A lot of times you feel real vulnerable and quivery in certain parts of you. It's natural. It's part of the body's expanding and contracting process. And if you can tolerate it, noticing it curiously and just guessing where it might be wanting to go and what it might be trying to do, without being too jumpy about any of it, it tends to both level out and leave you with a greater sense of connectedness and well-being. The reality is that the body thrives on your attention. As you breathe and as you bring awareness into the shape of you, even if your breathing gets a little tight for a while and then it starts to calm down, what I would want you to do is just pay attention to that and let the feeling level out. Let it level out at its own speed. Nice deep breaths. Pay attention to what the body seems to be trying to do, even if it can't do it yet. And if you have any cues on the inside for how you should move or change your position, go ahead and do that. Go ahead and pay attention to that. What tends to happen for people is their symptoms start to level out more quickly than before. Their ability to tolerate them goes up. Even if the feeling doesn't change in the moment while they're watching it, they tend to more quickly feel certain parts of them opening up and relaxing that they weren't feeling during the real rise in symptoms. And the reality is that even though I normally work with people on mental illness, post-traumatic responses, anxiety, depressive symptoms, addictive cravings and triggers with these sorts of things, it works very, very well with your response to your physical symptoms. your pain, your sickness, your illness, your side effects for medications. Those can be reduced by your being able to watch them curiously, to stay with the feeling and follow your body's cues, and to be contemplative and reflective about it as you continue to pay attention, more importantly, to where the feeling is, activating your proprioceptive sort of internal global positioning system, as opposed to jumping to the why you're feeling it. You're gonna ask why. It's a natural thing. You orient to bad feelings. You orient to urgent feelings. And your orienting response is really natural. If your initial question of why am I feeling this doesn't give you immediate results that help to relieve you and help you to get into the right direction, well, the next step is to get curious. Get curious as to where the feeling is, and to work with that feeling, to be curious about where it's trying to go and see if you can help it go there. And chances are, like so many others, you'll start to feel relief that comes more quickly, healing that comes more fully, and the ability to manage your day-to-day affairs better, because you're not overwhelmed by the ongoing internal onslaught of feelings. I hope you found this video helpful. Continue to breathe, pay attention to where your feelings are, and you have a good day.